Your kidneys are quietly failing, but you still feel normal. A 52-year-old man came in for a routine checkup. He said he felt completely fine. No pain, no symptoms, nothing unusual. But when we checked his kidneys, they were already failing. And the scariest part? He had been ignoring the signs for months because they didn't feel serious. Right now, as you're watching this, your kidneys could be slowly shutting down and you wouldn't feel a thing. No pain, no warning, no obvious symptoms, just silence. I've seen this happen more times than I can count. People walk in feeling normal and walk out realizing something is seriously wrong. So let me show you why this happens. And by the time most people realize something is wrong, up to 90% of kidney function is already gone. This isn't rare. It's happening to millions of people, especially over the age of 40. So the question is, are your kidneys still healthy or already in danger? Here's what makes kidney disease one of the most dangerous conditions in the world. It doesn't scream, it whispers. Your kidneys are responsible for filtering toxins, balancing fluids, controlling blood pressure, producing hormones your body needs to survive. But when they begin to fail, they don't shut down overnight. They decline slowly, silently. You can go months, even years, without noticing anything serious. And during that time, waste builds up in your blood. Fluids become imbalanced. Your body starts adapting in unhealthy ways. And the scariest part? You might feel completely normal. Doctors call this the early stages of kidney disease. But here's the truth. Most people miss it. Why? Because the signs are subtle. So subtle, they don't feel like a disease at all. They feel like, I'm just tired today. Maybe I didn't drink enough water. It's probably stress. But your body is already sending signals. You just don't recognize them yet. If any of this feels familiar, pay close attention to what comes next. Here's where most people miss it. Maybe you felt this before. You wake up tired, even after sleeping, and you brush it off like it's nothing. 1. Changes in urination. Your urine is one of the first indicators. You may notice going more often at night, foamy urine, darker or lighter color, less urine than usual. Most people ignore this, but this is your kidneys struggling to filter properly. 2. Constant fatigue. You wake up tired, you feel drained during the day. Even after rest, you're not refreshed. This happens because your kidneys help produce a hormone that supports red blood cells. When that drops, your oxygen levels drop, and you feel exhausted. 3. Swelling in feet or hands. Your kidneys regulate fluid. When they weaken, fluid starts to build up. You may notice puffy feet, tight shoes, swollen fingers. It may seem small, but it's not. 4. Brain fog and difficulty concentrating. Toxins that should be filtered out start circulating in your blood. This affects your brain. You may feel confused, slower mentally, forgetful. Again, easy to ignore. I've had patients tell me, I thought it was just stress until it got worse. 5. Loss of appetite or nausea. As waste builds up, your body reacts. Food doesn't feel appealing. You may feel slightly sick, especially in the morning. So why do most people miss these signs? Here's the problem. None of these symptoms scream kidney failure. They feel normal. They feel explainable. So people wait, and while they wait, the damage continues. At some point, the kidneys can no longer compensate, and that's when symptoms become obvious. Severe swelling, shortness of breath, high blood pressure, severe fatigue. And by then, the damage is often advanced. And this is where it gets serious. What's actually causing this damage? 1. High blood pressure. Constant pressure damages kidney vessels. 2. Diabetes. High sugar damages filtering units. 3. Daily habits people ignore. This is where it gets serious. Excess salt, dehydration, overuse of painkillers, processed foods. These slowly damage your kidneys over time, and this is what people ignore every day. Habit 1. Not drinking enough water. Your kidneys rely on proper hydration. Habit 2. Too much salt. Salt increases blood pressure, leads to kidney strain. Habit 3. Ignoring blood sugar. Even slightly elevated sugar over time is harmful. Habit 4. Overusing painkillers. Some medications damage kidney tissue. The good news? Small changes can make a big difference. Drink enough water. Control blood pressure. Eat less processed food. Monitor blood sugar. Get regular checkups. Final warning. Remember this. Kidney disease doesn't start with pain. It starts with silence. And by the time your body gets loud, it may already be too late. Because the people who lose their kidney function don't ignore it on purpose. They ignore it because it never felt serious until it was. Because your kidneys might be fine today, or they might already be struggling, and you just don't know it yet. Be honest. Have you noticed any of these signs lately? Yes or no?